Hello, welcome to my X-ray lab. Today we're going to be doing an AP axial projection of the temporomandibular joint, okay? AKA TMJ. The TMJ. I'm going to set my skull here. Alright, so the AP axial is going to either use an 8x10 or a 10x12 lengthwise. I'm going to use the CR since it's a smaller one. You want to make sure you have your marker, and as my patient, I'm going to make sure that she's shielded. And for this projection, make sure you take out any earrings and any glasses that they're wearing. So the two projections that we have to do for the AP axial is a closed mouth and an open mouth. The closed mouth, you're going to make sure that the posterior teeth are in contact rather than the incisors. For the open mouth, we're going to open as wide as possible, making sure that we're not protruding the mandible. So the patient is either going to be seated or you can do it supine. And we're going to position the patient's head like so. We're going to make sure that the mid-sagittal is perpendicular to the IR. We're going to flex the patient's head so that OML is perpendicular also to the IL. We're going to turn our tube, angle the tube so it's 30 degrees caudad, and we're going to center midway between the TMJ and 3 inches above the nasion. And we're going to collimate 8x10. So we're going to do just like that. Alright. So we're midway between the temporal and 3 inches above the nasion, with the OML is perpendicular to the IR. And everything is centered, my bucky is centered, like that. Alright, and then after you do a closed mouth, we'll also do an open mouth. So all she will have to do is open your mouth while we're not protruding the mandible. Alright, thank you, and I hope this explained a lot.
We're going to do the axiolateral projection of the TMJ articulations. So we're going to start with placing the patient in kind of an RAO position, and then we're going to put the head against the board laterally. The CR is going to enter a 1/2 inch anterior and 2 inches above the EAM, and you're going to angle 25 or 30 degrees down. So I'm going to kind of push you forward right there. Good. This projection also requires an open mouth image, so all you would have the patient do is open their mouth and recheck the positioning. The central ray will exit the affected side at the TMJ articulation, and that's going to be the affected side. And also we use a 10x12 crosswise. And that's that. Now we're going to do the axiolateral oblique projection of the temporomandibular articulations. The patient is going to be in an RAO position again. Their head's going to be lateral, but you're actually going to turn them in 15 degrees towards the board, if you want to like look there. So they're not completely lateral, they're turned in a bit. The CR will enter 1.5 inches superior to the EAM. So I'm just going to push you back a little bit. Good. And again, the side closest to the IR is affected, and it's marked right side. And again, we use 10x12 crosswise.